Let's talk about how I'm feeling for my double mastectomy tomorrow. If you've never seen my face before, my name is Lauren, and I was diagnosed with stage 2 breast cancer a week before my 22nd birthday. I've gone through 8 rounds of chemo, so next up in my treatment plan is surgery. I've decided to get a double mastectomy. The cancer is only on the right side in my breast and in one lymph node, but I also have made the decision to get a mastectomy on the left side as well, as a preventative measure and also just for aesthetic reasons. I've had several months to come to terms with this decision. I have been able to kind of work through whether I would want to do just a lumpectomy, do a single side mastectomy, do a double mastectomy, and ultimately I've grown super confident in the reasons why I'm making this decision, and I'm feeling ready for it. I'm feeling like this is the best move for me, and based on my attitude throughout my cancer journey, I know that this is what I have to do in order to feel like I can really move on with my life and not have these lingering fears of the cancer coming back. It's a 4.5-hour surgery because the surgeon has to come in, do the mastectomy, take all the breast tissue out, and then the plastic surgeon will come in after that and put the implants in. That is the plan typically, and from what I've heard from other people's experiences is they put expanders in, and then over like 4 to 6 months, they inject saline into the expanders to slowly get to the desired size that you want. But there is the option to go straight to implants, and that is what my plastic surgeon is aiming to do. So that's what I have in my mind as what the outcome is going to be. However, he said, obviously, if there's any complications and the skin is too weak, then he'll switch and put expanders in. So in my mind, there's going to be implants after tomorrow, but worst case scenario, there's obviously still the route of expanders if needed. I've had several discussions with both surgeons, and I just feel super confident in their abilities, and I've told them what I want out of the surgery, what my concerns are, what my expectations are, all of that. I've been very open and honest with them, and the responses I've had from them during my appointments have just been super positive. So I just have a lot of trust in them, and I have a lot of confidence that this is going to go well and that this is the right move. It's been super difficult for me from the beginning because this decision has been placed completely in my hands. There's been no opinion from any of the doctors I've worked with because it is such a personal choice. And as much as I respect and appreciate how personal this decision is, it's also a little scary when the decision is placed completely in your hands when I'm not an expert and this world of breast cancer is so unfamiliar to me. So I've wanted to just be like, no, you decide for me. And that was really overwhelming to have to realize I have to make this decision and I have to do research and decide ultimately what is going to be best for me in the future. So once I got over the overwhelm of knowing that nobody else was going to make this decision for me, that this was totally on me, I really just weighed my options and came to the decision that a double mastectomy would be best for me. And again, this was because I want to reduce the chances of this coming back completely as much as I can. But also a lot had to do with just aesthetics, and talking to the plastic surgeon, he explained to me that in studies, it's shown that if you get a single side, a unilateral mastectomy with reconstruction, people end up having a lot of work done on the unoperated side and are ultimately less satisfied because of the differences in their breasts from having the mastectomy. So one, I don't want to have to deal with this on the left side, and two, I want both sides to look as symmetrical as possible. So if they're both getting a mastectomy with the same implants, obviously I know that I can get work done to just do little touch-ups in the future, but both sides will be from the same baseline. So not that I have to justify this decision to anyone. I just think it's interesting to see how people come to terms with their decision and what like the process looks like and what their considerations are when having to make such a huge decision for their body. I think one of the biggest things I've learned in preparation for the surgery is that you need to be 100% confident and trusting in yourself that you've made the right decision for you, because again, this is a sensitive topic and area where people have lots of opinions, unfortunately. And while I've been lucky that my medical team hasn't been opinionated towards me, there's obviously people around me or maybe who haven't said anything to me necessarily, but are just confused as to why I'm doing such a big surgery, especially because I've gone through 8 rounds of chemo. So the automatic question is like, okay, well, if the tumor has shrunk so much, then do you not have to get a full mastectomy? But just because the tumor has shrunk doesn't mean that the cancer cells aren't still in there. So again, I just want to make sure bases are clear. There's no remaining tissue for cells to grow in the future. I've had time to come to this point of confidence, and I don't care if anyone thinks this is crazy or if anyone would do it differently, because you don't know what you would do until you're in this position. So anyone who has an opinion that hasn't gone through this journey, it really doesn't matter. So everyone's been asking how I'm feeling for surgery in general. I'm just a little nervous for the idea of surgery because it's a long one. It's 4.5 hours. I've never had a major surgery, so just thinking about being out for that long, how much pain I'm going to be in, those things are all anxieties running through my head. But other than that, as I've explained, I am ready for the surgery to happen. I've been counting down the days for the past couple weeks because I know that this is what needs to happen to get the outcome I want of having this journey come to an end. And I have a good outlook on it. I'm like, okay, getting new boobs. Like, let's just embrace the changes that are going to come to my body. I know my body's going to look a lot different, but I'll roll with it, right? Like, I know that there's going to be emotions that come with it as I go through my recovery, and I'm ready for that. But at the end of the day, sitting here right now, knowing surgery is tomorrow, I am comfortable with this drastic change that's coming to my body because I want the cancer gone. So I'm ready for a recovery. I'm confident that my surgical team is going to kill it and that I'm in amazing hands. I'm confident in my body, that my body's going to take care of me and that it's strong enough to heal through the recovery period. I know that I'll make the most of it. I'll find some new TV shows to watch, read lots of books, ready for some time to chill. Honestly, best time of the year for this to happen. I don't want to be outside in February in the freezing cold in Canada, so I'll hibernate. I'm good with that. If you have any other questions for me, I'm very open about all this, so I would love to chat more about it. Thank you for following along with my journey. Thank you for sending love, and I will keep you updated on how I'm doing post-surgery, and I will see you during my recovery.